Hi, I'm Dr. Paul Hodgson. Today we're going to be talking a little bit about concussions. Our awareness about concussions has grown so much in the last 10 years. And I have a unique story about concussions personally. I've had at least 7 concussions diagnosed on my own body, and probably a few that went undiagnosed. There's also been the movie Concussion, which has brought a lot of awareness to NFL players and how traumatic brain injuries can really affect us later in life. And I think having this new awareness means that we can ultimately treat concussions better. One of the most important things for concussions is we need to get a proper diagnosis. And it's really hard to get a proper diagnosis on brain function if we don't have a pre-measurement level of brain function. So one of the biggest challenges with trying to evaluate a traumatic brain injury is we might take a person with a very high level functioning brain, and when we measure them after a concussion, they're still higher than the average person. And so that becomes a challenge. So although they did have a concussion, it hasn't brought them down to the level where they're showing a whole lot of deficits. But it's still a problem, and we still need to try to get that person back up to where they could be or where they were. So I always encourage people who are going into potential athletic endeavors where they might incur a concussion to get a pre or baseline measurement. And we can measure things like cranial nerve function, nerve flow. We can measure all of your reflexes and kind of normal brain function. There's a really great app that I love patients, I love parents, I love trainers to download. Everyone should have this on their phone who's around youth sports. It's called PAR-CRR, Concussion Recognition and Response. PAR-CRR, Concussion Recognition and Response. And this app allows you to put in every time an incident happens, like your kid gets hit on the soccer field or your kid falls off the swing set and lands on their head and neck. It allows you to put in a time and a date and takes you through some basic things to look at and enter data in. And we can start to see if these concussions, these traumatic brain injuries adding up over time are affecting the overall brain function of the person. It's wildly more helpful than even some of our sophisticated brain testing that we can do right now, is to have a good log of all the things that have happened with the person. One of the things we do different in our office is we've pulled from several different concussion and traumatic brain injury protocols, as well as different neurological protocols that we use in other types of brain issues. This helps us evaluate the patient on a lot of different levels. And although many people are good at recognizing concussions, few people are good at getting people the proper treatment and the proper therapy to get their brains working at 100%. This oftentimes goes hugely hand in hand with chiropractic. One of the ways that chiropractic is so effective with concussion treatment is that we're able to identify proper biomechanics of the head and neck. Oftentimes we have an issue where concussion is involved with a whiplash neck injury as well. And we need to make sure that the relationship between the head and neck is appropriate and is working right, so that we can make sure that cerebral spinal fluid flows up and down the spinal cord, up and around the brain, and back. So some of the techniques that we do in our office are geared towards getting the brain working right. Some of the techniques are geared towards getting the bones sitting and moving properly. And some of the techniques are geared towards making sure we reestablish normal cerebral spinal fluid flow, which brings blood and oxygen to the brain and carries waste products out of the brain, allowing the brain to heal and get back to a better state.